Today it is my pleasure to welcome Melinda Tucker and Mauri Adamez to Healing, Hope, and Health. Melinda and Mauri have similar roles with Diacon Senior Living Hagerstown, both serving as sales and marketing managers at Ravenwood and Robinwood for independent living, assisted living, and the nursing home. They join us today on the program to talk about continuing care residential communities offered at Ravenwood and Robinwood. And as they like to say, these are two campuses, but one vibrant community with unlimited opportunities. They will also talk about the way Diacon Senior Living partners with Hospice of Washington County to meet the needs of residents at all three locations. Welcome, thanks for being here today.
Thank you. Thanks for having us.
Sure, so maybe we'll start with you, Melinda. Can you tell us, for our viewers, what a continuing care community, residential community is?
Sure. Diacon is a continuing care retirement community, and that just means we offer all the levels of care, from nursing home, skilled nursing care facility, assisted living, independent living, and we also have an adult day program.
Okay.
So we're able to offer those continuums where you don't have to leave if your health declines. You're not asked to go somewhere else. You can just stay right on our campus and we can take care of those needs.
Okay. And can you briefly describe the different living arrangements, what it means to be independent living versus assisted living and versus, I think nursing home people probably get that.
So we have 3 levels of care. We have our independent living in a cottage by yourself.
Are these freestanding homes?
Most are, yes. We do have cluster cottages, which have 4 homes.
Okay.
They're quads.
Quads,
yeah. Okay.
And then we have, so you can be independent there, and then if you feel like you need a little more help with home items, you can go to our assisted living and have an apartment there where nursing care can take care of your medications, they can take care of helping you bathe, get dressed, things like that. If you need even more care, you can go to our nursing care center, which does more skilled things, like if you need IVs, things like that. Wound care, yeah.
Okay. So if somebody's in an independent cottage and they need some assisted, do they have to move, or can the medical care come to them in that?
Therapy can come to them if they had a fall and they're getting treatment. They probably would start at our skilled nursing facility, get rehab there, use their Medicare days, and then they can do outpatient therapy once they're discharged and go back to their cottage.
Okay. Kyle Adamez, who's one of Hospice of Washington County's care consultants, works closely with both of you at the Ravenwood and Robinwood campuses. Can you explain some of the services that Hospice offers to your residents?
Yes, we have a great relationship with Hospice of Washington County. So we just want families to know that if they do need hospice or palliative care, that they can receive that in all of our continuums. They don't have to leave for that to receive those services. Kyle offers continuing care within our programs to our staff and to our family members and residents.
So he actually offers like educational opportunities.
He does.
That's great.
It's an added asset for us.
That's great. That's great. Could you tell us briefly how residents move from one level of care to another? Is there a process?
There is. If there's a decline in the cottage, we're going to see that, and we can look at them going to assisted living, sometimes just getting that therapy and going back into their cottage. So sometimes it's an in and out, where they're going from one facility to another just to meet their needs, but we want them to age in place. We want to keep them in our cottage as long as possible. So we have other outsourced resources for them to utilize to help with that.
Okay, and I know that you have a really vibrant community there. You offer lots of education kind of opportunities, trips. Could you talk about some of those, Mauri?
So we have all different types of activities. We like to keep our people involved in the community. We do things outside of the community, like shopping trips, things like that. We also have seminars where we do educations, a lot of times at our Robinwood campus because it's a little larger. And we invite community members, not just our community, but all of Hagerstown, Washington County.
I did see you're having a sushi making event. I thought I would like to sign up for that one myself.
So we like to be involved with everybody.
That's great. It enriches the folks' lives on there, and they enrich the larger community too. That's great. Melinda, when a resident moves into a skilled nursing center, how does the payment source? Who pays for that? How does that work?
It depends what payer source they do have. So we take Medicare and Medicaid. We're a Medicaid facility, private pay, and then there's managed care payer sources.
Like Aetna, Blue Cross, things like that.
Okay. So it depends on what they have, but we have a contract with a lot of them that we
So
can
you
take
work
that.
with each resident?
We do.
Yes.
That's
It's
great.
very individualized. So depending on, they have Medicare, they can come here, use our therapy services for up to
100 days.
100 days.
Okay. And real quickly, how many folks live combined in the Diacon Senior Living Hagerstown? Do you have an idea?
We have 80 beds in our nursing home. We have 40 at our assisted living at Ravenwood. We have 46 in our cottages at Ravenwood. We have 23 independent living at Robinwood, and we have 70 assisted living at Robinwood.
Wow, that's a lot.
Yeah,
Yeah.
a lot of people.
Yeah. Well, thank you so much for being here today and sharing that information with our viewers.
Thank you for having us.
Sure. Diacon Senior Living in Hagerstown combines the benefits of town and country living and offers a variety of housing arrangements to meet the needs of active seniors and those who require support or long-term care. Hospice of Washington County is pleased to provide palliative care consulting services, community education programs, and compassionate end-of-life care there or wherever our patients call home. If you have questions about Diacon Senior Living, please call 240-420-4133. And if you have questions about the services provided by Hospice of Washington County, call 301-791-6360. Stay with us. I'll be right back with our next guest.